time. Ready for it? All right. All right. Good morning, y'all. Turn it down a little bit. How's that? Can everybody hear me? Can everybody hear me? Pretty good. Okay, cool. All right, we're going to go ahead and get started. So, of course, today's lecture is on the human hand. I'm Dr. Ford, if you haven't met you already. This lecture has been uploaded to Blackboard. The recording will be up. Hello, hello. Try to. That's what I'm gonna do, put it in. Hello? How about now? Is that pretty good? Okay, yeah, so the recording will be uploaded to Blackboard. Are they able to see it right now? Pull it up on the computer? Okay, all right. Okay, cool. But this is gonna be a brief lecture. Just gonna go over the hand. Then we have lab this afternoon. You want me to go ahead and tell them what we're gonna do? So we're going to do lab from 1 to 1:30, and then 1:30 to 2. So only 2 sessions will be necessary, okay? I'm going to tell you exactly what you need to know for the quiz and for the test, and we'll get started, okay? So, like I said, this is the lecture on the hand, so you need to know, as you do know, the hand is a remarkable and complex structure that enables us to perform various tasks, right? Today we'll explore those, and then so the hand enables us to perform a wide range of activities, including grasping, manipulating objects, and fine motor skills. Plays a crucial role in communication, right, expression, and daily tasks such as writing, typing, and even eating. Okay, so the hand consists of 27 bones, okay, 29 joints, and there are numerous muscles, tendons, as well as ligaments, okay? Now, it's divided into 3 main regions: your wrist, the palm, and the fingers. Okay. So the wrist region, or the carpal bones. Hello?
Is this PowerPoint uploaded?
Yeah. Mm-hmm. Mm-hmm. The new one. Get the new one. Yeah. Okay. So like I said, there are 3 regions of the hand, okay? So we start with the carpal bones, which is the wrist region, right? And then you have your metacarpals, okay, which come after that, okay? And then that's the palm, and then your fingers or your phalanges, okay, which are the digits. So we'll just talk a little bit about this diagram. Of course, we know adduction, AD, is adding, right? Abduction, it will be spreading the fingers, okay? So how do we number the fingers? So it's usually 1, 2, 3, 4, and 5, okay? The thumb is 1. Okay, but we call them things like the little finger, the ring finger, the middle finger, or the index finger. Okay, so when you get into the clinics and you're doing your notes, you're going to refer to things that's like by the number. So the first digit will be the thumb. Okay, that's just scientifically speaking. Okay. Now these skin creases are something you don't really have to worry about. You know, it's just there. You also have the radius. Okay, and then the ulnar bone that's joined at the carpals, okay? So now let's talk about these. So let's start at the phalanges, okay? So the phalanges, or the digits, like I say, you see they're numbered here, okay? You have 3 bones. You have your proximal, middle, and distal, okay? You'll need to know that. You have your metacarpals, okay? And then here we have the carpal bones, and you need to know all of these, okay? All the bones within the wrist, right? Okay, so we'll start here. Capitate, hamate, the pisiform, okay, the lunate, trapezoid, okay, trapezium, and the scaphoid, okay? Should be 8 bones there. Those are very important. You will probably get a question on that, all right? Now, if you look down here, this is the arch of it. So this is the carpal arch. That's how it's set up. Here, so these are the same bones. I was talking about the pisiform, the hamate, capitate, trapezoid, trapezium, all right? So know all those structures. Okay, so the wrist is composed of, like I said, 8 small bones. Okay, these bones will provide stability and flexibility to the hand. They're also injured often when a patient falls, okay? The wrist allows movements such as flexion, extension, abduction, and adduction, okay? This is a radiograph Okay, you may get this, you definitely probably gonna see this on your exams and your steps, but just know these bones here. These are the carpal bones, radius, ulnar. This is a close-up view of, okay, the lunate scaphoid, okay, and the, as you can see, your ulnar, okay, and then your radius. So just know those bones, all right? So this would be the type of question that y'all get, okay? So we have a student is rollerblading on the diag, and while trying to avoid a bicyclist, falls heavily on the right wrist, okay? After falling, they note severe pain in the anatomical snuff box, okay? Snuff box is back here. Radiological studies reveal a fracture of the bone. The floor of the snuff box is called the what? Does anybody know what that is? Scaphoid? There we go. Answer is D, scaphoid. So here's the explanation. The scaphoid is the bone found at the floor of the anatomical snuff box. It is in the proximal row of the carpals and is frequently fractured. Capitate, hamate, and the trapezium are three carpal bones located in a distal row of the carpals, okay? The capitate is the largest carpal bone. It transmits force from the hand to the lunate and to the radius, okay? The hamate has a distinct hook, okay, the hook of the hamate. You're gonna see that often, okay? It is an attachment point for the flexor reticulum, okay? The trapezium is the carpal bone that articulates with the metacarpal bone of the thumb, okay? Forming a saddle joint. The lunate is the proximal row of the carpal bones located next to the scaphoid, and it articulates with the capitate. So this whole explanation right here, just know that. Pretty good stuff. Okay. Remember, answer is D. All right. The snuff box is going to be on this side. Anatomical snuff box here. All right. And I should have an image on here at some point, okay? All right, so the palmar region, okay? The palm is formed by the 5 metacarpal bones, like I said earlier. It contains the muscles responsible for gripping and manipulation, okay? The palm also houses nerves and blood vessels that supply the hand, and we'll go over that a little bit later. The finger region, we already talked about it. There are 14 phalanges, and each finger having 3 phalanges, except for the thumb, which has 2, right? All right, the phalanges allow for precise movements and grasping, and the fingers are controlled by the tendons that run through the palm and attach to the muscles of the arm. So we need to know bones, we need to know muscles, tendons, and then we'll get to the nerves and blood supply in a little bit. So the muscles of the hand. The muscles of the hand has 2, okay, muscle groups. It's your intrinsic and then your extrinsic muscles. And I have a diagram with all this on it that I'll show you a little later. So the extrinsic muscles originate in the forearm, okay? So like I say, extrinsic out of the hand, and then the intrinsic is going to be within the hand, okay? As you can imagine, the extrinsic muscles are more about gross movement of the hand, force, right? And then with the intrinsic muscles on the hand, it'll be a lot more finely tuned, okay? Here's a picture, all right? So you should know the insertion of certain tendons. So like here's the insertion into the dorsal hood, and this insertion into the base of the proximal phalanx. But what we're looking at, what we're talking about actually is the first dorsal interosseous muscle, which is the one here at the thumb, right? Okay? And then you have this image shows the radial artery and how it runs, right? So know this image, know these muscles and what they do, okay? What they're gonna do is abduction. They're gonna pull the hands apart. So if you know how they insert, it just makes sense, right? So if this muscle was to flex, it's gonna pull these fingers open, right? Okay, good. Okay, then you have your adductors, your adductors, right? And where they insert is gonna be more medial, okay? Insertion into the dorsal medial region, right? And so they gave us this one. So the first palmar interosseous, it says it's rudimentary, but when present is often considered part of either abductor pollicis or flexor pollicis brevis, okay? And that's the muscles of the thumb that we're talking about. So these are your adductors. These are your abductors, okay? Know those. Okay? So we have the transverse head of the adductor pollicis, right? So the adductor pollicis is going to be this top part here. Then we have the oblique head of the adductor pollicis. And I believe this is one of probably the largest muscle in the hand, right? And then you have the sesamoid bone, which is kind of right here in this thumb joint. But on this picture, we have the radial artery, okay, and it kind of shows how it courses around these bones, and that's important when we talk about injury, right? Same with nerves as well. So it's the radial artery going around there, okay? So let's talk about these muscles. Let's start here. Flexor pollicis brevis. We talked about it earlier. That was this one right here. Okay, they got a cutaway here. Okay, and as you can see, it's going to probably be innervated by which nerve? Median. Okay, and then that would do what? The recurrent branch of the median nerve. Remember that. Remember that one. Okay. Okay, and it is a branch of the median. The recurrent branch of the median nerve. Know what happens. What would you lose if there was an injury to it, right? All right. You see how the median nerve courses, okay? Through here, this is going to be another one, okay? And then you got to know the deep branch of the ulnar artery and the nerve. They run together, and I'll show you what they actually innervate, okay? Here we go. Okay, so these are just your ligaments. Know your ligaments, okay? Know the lumbricals and what they do. The lumbricals kind of just pretty much assist with the other muscles, okay? This flexor reticulum is going to be important because when we talk about things like compartment syndrome of the wrist is called what? Y'all know what compartment syndrome is? There we go. It's the same thing. It's just, yeah, so that's very important. That's going to be on the test. So know that as well, okay? All right. Here we go. So this is what I was talking about. So this chart has your muscles. All I want you guys to know is the muscle, its innervation, and its function, okay? You don't necessarily have to know the nerve roots, but definitely know the nerve, the direct nerve. Okay, it's only two nerves. It's the radius, it's the ulnar, and then it's the median, right? Okay, so know this stuff. Okay, thenar muscles, muscles of the thumb. Like I said, know these, know this. Okay. You hear me? Yeah. No one, no this one. No abductor pollicis brevis, flexor pollicis brevis. And then, you know, its function is in the name, right? Yeah. And then know what would happen if the nerve was injured, or if there was, let's say they give you a case, they say you're unable to flex your thumb at the metacarpophalangeal joint. What nerve could have been injured? Boom. What did I say? Recurrent branch of the medial nerve. All right. All right. Tendons and ligaments. Let's kind of go through those. So tendons are the fibrous tissue that connect the muscles. Y'all know that. This allows the muscles to control the movement of the hands. The ligaments are strong bands of connection tissue that holds the bones together, providing stability of the hand. Okay. Know these ligaments. You have the palmar ligament, capsule of the metacarpophalangeal joint, don't worry about that. Then you have these deep transverse metacarpal ligaments. Okay, that's down here, that's what's keeping the hand together so it doesn't abduct too far, right? Nerve supply. Like I say, the nerves of the hand is richly supplied with nerves. It includes the median, ulnar, and radial nerves. It can be sensation and as well as for muscle control, right? The effectors. The hand also receives a robust blood supply through these arteries and veins, ensuring proper oxygenation and nutrient delivery. Okay, so know how these blood vessels course. Also, might be helpful to know anastomoses as well. Okay, so you have the ulnar, the radial, so the radial artery running with the radius. Okay, you have a deep palmar branch. Okay. That connects with the ulnar. It connects the radius and the ulnar. Okay, the hook of the handmaid is going to be under here. So, like I say, and then you're going to get the recurrent nerve that runs along with this. Okay, You have the superficial palmar arch. Okay, this is going to be the blood supply to the palm of the hand. And as you can see, how the blood runs up through here and then back around tips of the phalanges and back down into the hand, okay? This right here, mainly on the artery. So put your hand out. These 3 fingers, 1, 2, 3, okay? And then the 2 over here. Half of the index finger is going to the ulnar, half is going to the radial artery. It's very similar to the actual nerves, right? Because we know that the nerve, which I probably have a picture of it, the nerves, okay, is going to get, radial is going to be the thumb, and then half of the index finger, and then the ulnar nerve is going to innervate the other 3, okay? Know this picture, okay? This is pretty much saying the same thing. Let's get that one, okay? This seems like a lot, but it's just like the other pictures, okay? Now,
Would we have an anastomosis at the index finger only?
where are you at? Here? You talking about here? Like, would it be only here?
Would it only be at the index finger and not the other?
It's all the fingers.
But they are all ulnar arteries.
Oh, you talking about like, oh, yes, so I'm talking about the anastomosis here. There's no anastomosis in the fingertips. Yeah, down in the palmar region. Okay, as you can see how rich this blood supply is. Look at all the vessels here. All these are just going to extend straight into the distal phalanx. Right? Okay, this one just goes over the radial artery. There's no what would happen if you had an injury or bleed there. Okay, this will talk about the radial and the ulnar, same thing. Okay, all right. Veins run with arteries, right? So we do have an anastomosis here at the snuff box. All right. Now, the only thing about the veins is you have the basilic vein and then the cephalic vein, okay? They're not going to be radial and median, okay? And then you have this dorsal venous network. Okay? So we already talked about this. Their distribution of the superficial branch of the ulnar nerve, or what does the ulnar nerve innervate in the hand? So like I said, it's the wrist, this side of the wrist, the ulnar side, right? The pinky finger. You're going to get half of, oh yeah, I said it wrong, half of that, and then half of the ring finger, and then the pinky finger, okay? This is your dorsal view. Know that. Okay. Here again, we talk about the recurrent branch of that median. Okay, if you got an injury here, you won't be able to, opposition of the thumb will be lost, right? Okay. The median nerve runs underneath this sheath here. Okay, and that will be important because if you get, we're talking about what? Carpal tunnel, right? Okay, good. What is this? See it at the bottom, right? So this is claw hand. So if you lose that ulnar innervation, right? And where am I here? Let's go to ulnar, right? So if you, now this is what wants to happen. All right, you think if you lost it, it wouldn't function, right? But if you lose that innervation, you lose, you still have the hand trying to pull down. So opposition, right? So it wants to pull the fingers up this way. But if you lose innervation, it's going to kind of curl down like that, right? Because the muscles of the forearm are going to be pulling it. And that's how you get that claw hand, okay? So no claw hand. There's something called Dupuytren's contracture. Know that. I'm going to send that to y'all. Yeah, I'll send it to you, okay? And then here's the superficial branch of the radial nerve, okay, and what it innervates. Of course, superficial means it's just going to be on the skin, and then we're covering, as you see, the thumb, and then half, the more proximal half of the first, second and third digit, right? Question. This is the type of question you're going to get. Remember I said symptoms of carpal tunnel syndrome may vary among patients, but they all always result from compression of what structure in the carpal tunnel? There we go. All right. So carpal tunnel syndrome is caused by a compression of the median nerve within the carpal tunnel. The carpal tunnel is a canal in the anterior side of the wrist. It's made of the carpal bones, like we said, they're covered by the flexor retinaculum, okay? It contains the tendons of flexor pollicis longus, the tendons of the flexor digitorum superficialis, and the profundus, as well as the median nerve. I think I have a picture, a cross-section of that. If not, I'll be sure to upload that, okay? If the sheath over the common flexor tendons, the ulnar bursa, becomes inflamed, okay? This can compress the median nerve, okay, and the canal leading to pain and weakness in the hand. None of the other structures mentioned in this question are contained within the carpal tunnel, okay? Yeah, know that. And that's it. That's all I have, y'all. There's a diagram I'm gonna upload that goes with this, okay? Good job, y'all. I'll see y'all in one. If y'all want to break up into two groups, so one group comes in, yeah, it's gonna be quick. Okay. Hey, Doc.